Hi, my name is Jamie Holt, owner and physical therapist of Holt Physical Therapy and Performance Training here in Raleigh, North Carolina. I wanted to talk about a topic that is not very talked about very much, called the hip cuff. The shoulder is not the only rotator cuff that we have, and we really need to pay attention to strengthening up this joint, and we're going to show you why that's important. If we look at the anatomy of the shoulder here on the right, you have your humeral head that fits into the glenoid fossa. That's a ball and socket joint. Well, your hip is the same way. We've got the head of your femur fitting into the acetabulum. It's a ball and socket joint. The good thing about a ball and socket joint is it's extremely mobile. The bad thing about a ball and socket joint is it's extremely mobile. Therefore, we have to have good muscle support, good muscle stability to make it a proper moving joint. If we look at the muscles, the ones on the right here, those are bigger muscles. We call it the powerhouse or the cottage of wattage. Those are our glutes, our gluteus maximus, our gluteus medius. They give us a lot of power. That's where we get a lot of our power from. On the left is our deep rotators, or our rotator cuff muscles of our hip. The piriformis muscle, the gluteus minimus, the superior gemellus and inferior, the obturators, the quadratus femoris, those are all hip stabilizers, hip rotators. We have to have that good and strong to have a good stable hip and a good mobility and movement in that hip. This diagram depicts what happens if you have tight hip flexors. And a lot of us have tight hip flexors from sitting too much, from our sport, from just overall life. If we have tight hip flexors, we're going to have a weak abdominal wall, tight muscles in our thoracic spine, and weak gluteus maximus muscles. We can work all day long on massaging the back, working on core strengthening, working on some glute stuff, but if our hip flexors are still tight, that we're going to have a problem and not be successful. We've got to get those loosened up and get them mobile. Looking at this diagram, if we don't have good hip stability, you see how the femur is going to internally rotate, your tibia is going to internally rotate, and your foot is going to overpronate, causing a valgus movement at your knee. What we initially thought is when your tibia rotated internally, your kneecap went with it. Well, what we're finding is that your kneecap stays laterally. And so what you're doing, instead of having smooth cartilage rubbing on smooth cartilage, we now have smooth cartilage rubbing on unsmooth cartilage, causing pain, irritation, inflammation, and therefore dysfunction. So we need to minimize this by working on strengthening up the hip stabilizers and getting the hip very good and strong. That'll help decrease this from happening. If we look at the anatomy of the shoulder, the job of the rotator cuff is to compress and depress the humeral head during movement. If only the deltoid is firing, the shoulder is going to shrug up, and that's not what we want. We need to have the hip stabilizers just as strong. We don't want other muscles kicking in doing that work. So that's why we have to really work on our hip rotator cuff. Take a picture on the right. The one on the left is the shoulder rotator cuff, and the one on the right is the hip rotator cuff. It looks very similar. Some causes of these issues can be weak hip stabilizers, some postural influences, imbalanced training program, and improper stretching. All this can lead to tight hip flexors, weak hip stabilizers, and to have proper movement, we need to address that. Some signs and symptoms of weak hip stabilizers and poor hip mobility is hip pain. It can present as back pain, knee pain, groin pain, decreased strength. You can have piriformis or IT band type syndrome issues. Treatment would include, we have to strengthen our hip. We strengthen our shoulder rotator cuff all the time, so why don't we do it for our hip? We need to do hip stability mini band exercises. We need to be doing a dynamic warm-up. We need to work on ways to mobilize and release and move our hip flexors better, whether that's with dry needling, massage therapist, Graston, or any other manual techniques. You can go to our YouTube channel at Holt Physical Therapy if you search on YouTube, or our website at www.holtpt.com, and find our exercise videos on the dynamic warm-up, the hip stability mini band, as well as a video of active isolated stretching. All these will help you improve your mobility in your hip and strengthen up your hip stabilizers. I hope this short video has been helpful, and some of you can use these in your treatment and before you work out. And if you have any questions, please feel free to reach out to us at holtpt.com or give us a call at 919-803-0738, or even reach out to me by email. My email address is jholt@holtpt.com. We hope you have a great day, and we look forward to getting you back in the game.